Okay, I turned it on.
Hello and welcome. Please just give us a moment. I think we're going to start here soon. Thank you for joining. Hello and welcome, everyone. I hope you can all hear me and see these slides. Please let me know if you cannot, but it's my absolute honor and pleasure to welcome everybody to Texas Falls Prevention Awareness Week. Actually, as everyone knows, Wednesday is the first day of fall. So each year we make that National Fall Prevention Awareness Day, but we honor the entire week. And as you know, we should be honoring the entire year, because falls don't just happen 1 week, 1 day, 1 month. We really need to make sure that we do our best as a community, as a society, to protect our older adults against falls, all the various risk factors, and have a variety of solutions to keep them safe, prevent and manage falls. So it is my honor. My name is Matthew Smith. I am co-director of the Texas A&M Center for Population Health and Aging, also with the Texas A&M School of Public Health, and a huge advocate and supporter of fall prevention awareness activities throughout the state, throughout the country. So it's my honor to be here, but I really wanted to go ahead and open this up and say thank you to all of our sponsors. When we have all of these different organizations coming together, working together to support our older Texans. So today we'll be hearing from Texas Healthy at Home, but we also have the Texas Association of Area Agencies on Aging, Unite Us, and the Texas Health and Human Services. So wonderful group, outstanding synergy. Welcome to this week. And it's going to be a week of virtual events. If in fact you have not yet gone, please go to our Texas Falls Prevention website at Falls Prevention Texas, all one word, fallspreventiontexas.org. And you can see our events and some resources. You can even take a survey to tell us more about what you're doing in your local area. I'll go ahead and continue on by saying we have some great and exciting news. On August 19th of this year, our governor has declared this week, September 20th to the 24th, as Falls Prevention Awareness Week in Texas. We have the full proclamation available on the website I just mentioned, fallspreventiontexas.org. And if you go to the resources section, you can see that. I'm ever so quickly going to read this because I think that it's well written. It drives home the points that we want to support and embody over this week, but also throughout the entire year and of all times. So allow me to read this for you very quickly. In the Lone Star State, we are proud of the older Texans who have helped shape our state and contribute to our rich culture and history. These adults, ages 65 and older, represent more than 12% of the Texas population. Unfortunately, more than 1 in 4 older adults in the United States will suffer from a fall, the leading cause of fatal and non-fatal injuries among older adults. Falls are costly and can negatively impact a person's independence and quality of life. Annually, over 3 million older adults are treated in emergency room departments, and more than 800,000 are hospitalized due to a fall-related injury. Fortunately, evidence-based programs can reduce older adults' falls risk and fall-related injuries by encouraging them to engage in exercises that improve balance and strength, manage their medications, check their vision, and reduce in-home hazards. By taking certain precautions and staying diligent, falling does not have to be a normal part of aging, and we can ensure that older Texans can live their golden years successfully. The Lone Star State is home to several great resources that educate and provide programs to reduce the risk of falling. The Texas Active for Life Coalition increases awareness by promoting multi-component strategies to engage older Texans to take steps to reduce their falls risk. Additionally, the Texas Health and Human Services Texercise Initiative encourages older Texans to engage in physical activity and maintain a balanced diet, and also offers programs to implement assistance in adopting healthy lifestyle behaviors. At this time, I invite all Texans to learn more about what they can do to prevent falls. Through education, planning, and care, we can minimize the risks to improve health and safety and the well-being of Texans who are older. Therefore, I, Greg Abbott, Governor of Texas, do hereby proclaim September 20th to the 24th, 2021 to be Falls Prevention Awareness Week And that's just amazing. So thank you for allowing me to read that. It really does embody what it is that we're here to accomplish. I would like to go ahead and pass this over to our Assistant Director of the Center for Population Health and Aging, Ashley Wilson, to talk a little bit about the Falls Prevention Awareness Survey and tell us more about what we've learned to date.
Hi, thank you, Matthew. So this year we decided to send out a survey to our partners across Texas to see what kind of events different people are doing around the state related to Falls Prevention Week and Falls Prevention Awareness. Each year at the end of Falls Prevention Week, a member of the Texas Falls Prevention Coalition fills out a survey for Texas that goes to NCOA that tells what we're doing across the state. But this year we decided to gather that information before the week. So we've had about 23 responses so far, and you can see the direct link to the survey here. It's also on the Falls Prevention Texas website under the resources page, but we'd like everyone here to take that survey if you haven't done so already, and then send out to any partners that you know that may be doing things this week or in the month of September related to falls prevention. And then we'll collect those responses. And like I said, the Texas Falls Prevention Coalition will fill out the national survey and report back to them what Texas did. So we have 23 responses. We have some AAAs that have filled it out, Meals on Wheels, some academic partners, community centers, and senior living, as well as some of our corporate partners as of right now. And mostly around the state, here's some of the things people are doing. They're providing falls prevention presentations or webinars to older adults. They plan to distribute falls prevention educational information. Some are doing health fairs or conducting falls risk screening events. And then they're also active on social media this week. And a lot of these things that we encourage you to do this week on Facebook, Twitter, e-newsletter, the Center for Population Health and Aging, along with our partners that have put on Falls Prevention Awareness Week, have some of those materials available on our website. Again, that's fallspreventiontexas.org. There's also some people that are starting or kicking off new EBPs this week, so we're excited about that. And then next slide, Matthew. The other thing we asked in the survey was for anyone to report any events that you're having across Texas, so we can get a catalog of those this year and just see what went on. So far right now, these are the 3 areas that have reported having events. And even if the events have come and gone or later in the month, we'd still like to know about those and can include those in the national survey. So thank you to Brookdale Senior Center, the Brazos Valley Area Agency on Aging, and the Area Agency on Aging of East Texas for reporting those events to us. So again, that link was on this presentation. It's also on our website. So please take the survey and send that out to your partners.
Thank you for that, Ashley. And really, please do take that survey and tell us more about what's going on around the state. We'd love to report about it and show our collective efforts in Texas. But here's why we're really here today. What a great way to kick off Falls Prevention Awareness Week, other than this amazing individual, Christina Bartha. And I have the pleasure of knowing Christina, working closely with Christina, but also introducing her. So Christina, since 2018, has been with Art & Spirit. And Art & Spirit is a consulting firm that supports nonprofit executives in fulfilling their organizational missions. Christina herself has extensive experience in a variety of skills, including grants management, program planning, and implementation of programs, and the facilitation of many different evidence-based programs, including chronic disease self-management, diabetes self-management, really a lot of the chronic disease self-management education programs, as well as a Matter of Balance, the Aging Mastery Program, Blue Zones, etc. Before working with Art & Spirit, she worked with 60 and Better, which is a 501c3, also with the United Way of Tarrant County and the AAA of Tarrant County. So again, just great, wonderful experience. Christina is currently pursuing her doctoral degree in leadership and gerontology from Concordia University in Chicago, and holds a Master's of Science in long-term care, senior housing, and aging services from the University of North Texas, and a Bachelor's in Arts from the University of Texas in Austin. I don't need to go on and on about her because she's going to do it herself. Christina, I am here to control your slides. Welcome and thank you. I will turn it over to you.
Excellent. Thank you so much, Matthew and Ashley, and everybody involved in putting this week of webinars and information and education for everybody listening. We just appreciate all of your efforts, and I am delighted to be here today. It's a pleasure to be able to be with you all. So like many of you, I have participated in Falls Prevention Awareness Week for several years now. I remember when we celebrated Falls Prevention Awareness Day, and then we needed more time because there was interest and a need for it. So it became a whole week of activities and education around falls prevention. So it is so exciting to see the progress that we've made around falls prevention in the last several years, especially in terms of building and expanding the falls prevention infrastructure and enhancing integration of systems and partners. Next slide. We have a long history in Texas, as many of you know, in falls prevention efforts on the local level and the state level. Over a decade ago, the Texas Falls Prevention Coalition was formed and consisted of partners all across Texas working toward the common goal of falls prevention. That coalition evolved. We now have, as was stated earlier, Texas Active for Life Coalition led by Texas A&M. And, you know, along with these statewide coalitions and collaborations, sustainability is, of course, as we all know, an integral part of falls prevention or any programmatic activities. And we have to be able to sustain the work we're doing and the programs that we're offering. So to sustain falls prevention activities, Title III funding has been used, AAAs. If anybody from area agencies on aging are on the call, you all know how necessary that Title III funding is to sustain your programs, as well as administration for community living grants. One administration for community living grant that I've been closely involved with, that I'll be focusing on the efforts of on this particular webinar. Over the past 2 years, I've been a part of the grant management for falls infrastructure expansion and integration enhancement project. So this was a grant, we refer to it as SPY Squared. It was awarded to United Way of Tarrant County in 2019. And it came after a couple of other falls prevention grants that ACL funded. So, but this grant in particular is very focused on infrastructure and expansion and integration enhancement. And I'll talk a little bit more about that. So one of the primary desired outcomes of this project was to develop an accessible electronic class scheduling and coordination system to strengthen the infrastructure, efficiency, and communication of the falls prevention network in Texas. So this presentation will discuss how Texas Healthy at Home, a 501c3, address the long-time need for such a system and put ideas into action through licensing the use of Juniper, which we'll talk a little bit more about later. But you'll see Fort Worth Safe Communities Falls Prevention Task Force on this slide. And this is a local group in Fort Worth that started probably around 2011. And we met regularly to towards falls prevention efforts in the city of Fort Worth. And one of the problems that kept coming to the surface was that we did not have that coordinated way to make referrals and track our activities as far as falls prevention went. And what we realized is this went beyond Fort Worth. This was a larger issue that needed to be addressed throughout the state. So we identified that need for that online coordinated referral and tracking system, and that's what we'll be talking a little bit more about today. Next slide. So after a great deal of research and discussion and consideration, Texas Healthy at Home decided that Juniper would be the best fit for a web platform that would support delivery of health promotion programs and not only fulfill that deliverable for the Phi Squared grant to have a coordinated online system for referrals and tracking, but it can also be used, by statewide partners. We're going to talk a little bit more about the features of this system that support the Texas Healthy at Home website. So Texas Healthy at Home licensed the use of Juniper just this year, 2021. Juniper is a web platform supporting the delivery of health promotion programs. It's a relational database. It provides data collection capabilities, as well as can create custom reports. It's an ideal system for area agencies on aging, ACL grantees, as well as community-based collaborations with healthcare sector organizations. That's an important one. Next slide. So this system has so many different features and benefits, and by going to texashealthyathome.org, you can see what capabilities the system has and how it can help your organization. So I'll list a few of these here on the next couple of slides, and then we're actually going to show you the website. And right now, though, you can see that you can find classes based on program interest or participant location. So participants or caregivers or healthcare providers wanting to make a referral to a class can actually find the classes based on what the participant is needing and what they're interested in and where they're located. You can type in the zip code and find a class nearest to you. There's a way to get to Google Maps and actually have the map of how to get to the location of the class. And those of you who have been, which I'm sure everybody on this webinar has been, in this, working with programs for many years, this is a great function to be able to make it easy, simple for participants to be able to access classes. You can sort the classes by distance and date. This is also a great tool for marketing, promoting classes, and it's all done within a secure referral portal. And that secure referral portal is an important one for healthcare providers when they're making referrals of patients or clients to be able to access classes. Next slide. So here are just some of the other features One that you can see that's of great interest is the ability to track participant level health insurance information. And this is attractive to potential payers, which could lead to funding, future funding to sustain the programs. Next slide. Some of the programs that are on the texashealthyathome.org website are listed here. You can see A Matter of Balance. That's one of the most popular ones. Stepping On, Enhanced Fitness, Bingo Size, Walk with These. I mean, they're listed here. There are also programs. We were specifically focused on falls prevention today, but there are other programs listed as well in chronic disease self-management, aging mastery program, and other evidence-based programs. So there's a wide variety of top-tier evidence-based programs available for participants to sign up for. Next slide. So you can see here with the graphics on the screen, the top graphic kind of shows, this is kind of getting into my head a little bit, but this is kind of how it felt as we were starting to try to put all the pieces together to build and then eventually expand the infrastructure of falls prevention in Texas. No small undertaking, and then enhance the integration of programs and partners and systems. It just at times, you know, it can be difficult, challenging, a little messy at times. And you can see in the bottom graphic, you know, it eventually, you know, becomes more defined, has a clearer direction. And texashealthyathome.org, supported by Juniper, we really feel that this has been an integral way of creating that definition and that direction to expand our infrastructure and enhance the integration of falls prevention in Texas. I would be remiss if I didn't mention the little bump along the road, quote unquote, COVID happened. And of course that stirred everything up for everybody. You know, our falls prevention efforts and program activities were no exception to that. Many of the programs listed on the texashealthyathome.org website can be offered virtually, and there are, so you'll see on the website that you can participants or, you know, caregivers, you can register for classes that are, there are online options for the classes, and there are also in-person options for the classes. So I just wanted to throw that in there. It's kind of understood at this point along the road, but that was definitely a challenge along the way that we have addressed continuously since the onset of COVID. So from here, what I'd like to do is introduce, as long as technology agrees and cooperates with us, shift over to the texashealthyathome.org website and have Diana Reusch, who's on the call as well, who is our resident website expert guru. She knows the ins and outs of this website and of the Juniper system. She does data entry for us and troubleshoots and problem solves this technology that we've been learning about since we started the website and since we got the license for Juniper. So Diana Reusch will be taking over from here. I'm not sure if you want to go to the website, Matthew and Diana, from Diana's end or from Dr. Smith's end.
Hi, thank you, Christina. Matthew, could you let me share my screen? I've actually got the website up. Let's see.
I see it up on the screen now, Diana.
Yes,
Okay.
I'm sharing it now. If you're unable to share it, you can just walk me through and I will follow your lead unless you have something pre-planned.
I was actually going to show our classes that we have that are already existing. Am I able to share my screen?
You should be able to. There should be a green arrow, Diana, that just says share
Ah,
screen. Since you're a panelist, you should be able to
here we
share it.
go.
There we go. Yeah.
Okay, that better? Okay. Yeah, I just wanted to be able to show you the classes we have. So thank you for that. So here's our homepage. If I want to look for a matter of balance class, I'm going to go right into the top here, find a class, and click on matter of balance. I can either click the online button or search a zip code. Either way, it's going to pull anything up in the immediate area. So it's going to show any classes that we have existing out there. You can schedule or you can search within sort by distance or mileage. And you can directly register, go right into registering. So what you would do is just fill out all of the required information here. Then we would reach out to you to let you know that the participant's been registered. And these are all the class times, dates, the location of the class, the cost, if any, if there is a Zoom link, anything of that nature that would show here, or and if you wanted to go into that location, it's going to take you into the Google Maps, like Christina was talking about. That's really fantastic. So, and then we have a wonderful option that's making the referral. You can make a referral. Anybody can go straight into this to make the referral information. It does ask for some insurance information, but it is not a required field. The refer information as well. Both parties will receive confirmation from us, and then somebody from Texas Healthy at Home will reach out to the person being referred to schedule a class, find a class that's convenient for them. And then the same thing with the healthcare providers. Healthcare providers can go in, make a referral. It's going to be the exact same page there. Now we've got a really cool section on here. Anybody that wants to be a class leader can go directly into register your organization. And again, you'll receive an email from us letting you know that we've received the information. This is pretty neat because you can select all of the programs that your organization implements at this time if there's a license holder. And you can always go back and edit that as well. And if I go into the back page, this is going to show all the classes, and this is the live site. So these are actually classes that we have existing here. Our Heart of Texas Council of Governments in Waco, they currently have 9 or 10 matter of balance classes out there. Some are pending completion, a couple of complete. It gives you the status, um, the start and end date, location. We have some of our Dallas Area Agency on Aging in here, Texas Healthy at Home, but it gives you the variety of the classes there. So if I want to go to click on one of the classes. I don't want to show any of the personal health care information, so I'm not going to go beyond that on the bottom. So it's going to give you this information on the top. If there are any notes, Zoom notes, links, directions, anything of that nature. Here are your the class dates. If there's the funding source, if there's a cost, the number of participants, you can limit the class size from the front end. Here are your leaders. And another tracking tool that we have available for class leaders also is to track their certifications. So that's pretty neat. Over here are going to be the sessions for the class, the dates and time, and the participants can actually register themselves in the class here. They can actually do their own surveys through this, or you can through this area right here. And then we've got some reporting. I'll go right into the reporting. This NCOA button, that NCOA is going to directly upload an ACL report, and you're going to see the website's actually going to give the participant identification. They're going to set that up as the ACL is recorded, the first two digits of letters of first name, last name, and the birth year. Sorry there. So it goes right into it, and it's just with a click of a button. It's really does everything for you. So with that, I'm going to go back to the home page. So that's just kind of a brief overview. And it's really exciting. All of the websites that I've worked on in the past, this really is well, a one size fits all. And it's very easy to use. So if anybody has any questions, I will mute myself, or you can put them in the chat room.
Thank you so much for showing us around. I think that's wonderful. And this is an amazing platform and resource. It really does make it efficient. Can you all elaborate a little bit more just about the overall vision and how it is that you're going to get more individuals, more organizations using the platform? Talk to us. What's the plan? How can we all help?
Yes, Christina, would you like to take that one?
Yeah, yes, absolutely. So with Texas Healthy at Home, Diane and I have done a couple of more in-depth demos just like this one over the past, I guess, 6 months or so, since we purchased the license for Juniper, just to walk potential partners through the capabilities of this system. So we've done these demos for area agency on aging, through the T4A network, hospital systems like Texas Health and Baylor Scott and White. So just at this point, we're just educating potential partners about how the system works and how it could be a benefit to them and their particular organization, because different organizations have different needs. But like Diana said, and Matthew alluded to, I mean, this is really a great resource for all stakeholders. So I think, at this point, if you're interested in learning more about this platform and how it's used and how it works and how it can benefit your organization, reaching out to Diana or myself to learn more and to set up a more individualized demo or conversation would be a first step in that.
That's wonderful. Thank you for that. Think more about the platform itself. I mean, I'm just watching Diane scroll through. I mean, it just seems to have such, utility for all of these different audiences. Where do you all think the greatest structure will be? From Christina, what you've said, from what kind of feedback you're getting from the website, is it going, directly to the AAAs and working with the Aging Services Network? Is it working with the providers and the healthcare clinical entities? Is it going directly to the participants and having caregivers involved? I mean, it's so pre-populated and versatile, just all of this great information in one place. Where do you see the probably biggest, bang for the buck, so to speak?
At this point, what we've seen is, just in our limited experience so far with the system, I think the area agents who's used the system so far are area agencies on aging. And for example, the Heart of Texas Council of Governments, AAA, as Diana showed, they have several classes listed on the website, so participants can go on and register for the classes, and that has been the major consumer, if you will, of the system so far. Although we have had caregiver programs as well, that participants can go on and sign up for from around the state. So Savvy Caregiver is one of those that is that's not exactly related to falls prevention, but it is an evidence-based program that nonetheless. So participants or caregivers can go on and sign up for the classes. I think to this point, the audiences that we've reached the most up to this point who are actually using the system are the AAAs and then the participants and caregivers themselves. The healthcare systems, they're just larger, and it takes a little more time to integrate a new system into their process. So that may take a little bit longer, but the referrals by the healthcare system, we are seeing those. So Diana showed how easy it is just to go up to that link or the little subheading up top, make a referral. And that's as easy, super easy for healthcare providers who are working directly with patients to go on and make that referral to whatever program fits the needs of their patients. I see some really good questions and food for thought in the chat box here about maybe the features of Juniper. So Diana, the ins and outs, in detail about Juniper's features. Do you have any that you think are just really stand out as far as Juniper features? And how do these create efficiencies for the users?
Well, I think depending on, whether you're a participant or healthcare provider or a AAA, there's a little bit of something for everyone, honestly. To me, the ease of finding a class, it's immediate, really. And on our end, I would say the reporting is so simplified. There are a lot of different reports that you can create through Excel. And depending on how efficient you are in Excel, that you can drill down, as far as you want to get that level of detail. So I just really think that it's, to me, the reporting, I guess, but the ease of finding a class for the participant, the referrals are wonderful. Tracking the leader certifications is really important. So there's just it's very robust, and that's just like the best word that I can kind of come up with, because there are so many, after looking at so many different reporting websites, and it just really does have it all.
And Diana, I agree so much with what you just said, and it goes to one of Matthew's questions in the chat box as well. How does this fit into Texas's toolbox of fall prevention solutions? I mean, here we are, Falls Prevention Awareness Week. This is the first year that we've gotten to, that we've had something like this. I mean, this is a huge step forward for falls prevention in Texas, because it is accessible to participants and caregivers to, not only from around the state, but from anywhere. Loved ones can go on and see, if your mom has fallen and she lives in Texas, but you live in another state. I mean, you can go on and see what programs are available near her to help with preventing falls in the future. So that's so good, because that has been an issue in the past, and there's not a lot of funding for marketing and promoting programs. I mean, sometimes there's not even a designated staff person to do that. So TexasHealthyAtHome.org can be a solution to that. And then when healthcare providers are we're wanting to share these programs with healthcare providers and insurance providers, and share all the benefits of how they can help the patients and the clients, and directing them to one place, TexasHealthyAtHome.org, nice and neat, and accessible to be able to get to quickly and easily and efficiently, because folks are busy and they don't want to take a lot of time. So going here and seeing what's available, it's just at your fingertips and easy to access. So it definitely can fits very nicely into the toolbox of fall prevention solutions that we have as far as education and accessibility. So thank you for those questions, Matthew. It gets you thinking for sure. And I open it up if anybody else has any ideas. I know there are those on the call who have been involved in this work for many years. So.
Yeah, I think these are wonderful, wonderful points, and I appreciate you raising them, because, to me, what I see as very exciting is the data elements, but then again, that's where I sit. But with those data elements, being able to better understand who we're reaching, who we're engaging, a better picture of the actual infrastructure and those touch points to be able to get older adults the resources, the services they need, is just so very powerful to synergize the entire state. Texas is huge. Texas is disjointed. Texas is diverse. So having something like this with common data is so very important to look at those efficiencies, the time it takes to get them connected and move. But also these programs, these resources are wonderful, but they're only one piece of the larger needs and solutions for older Texans. So therefore, being able to have this link with some other wonderful resources, having the healthcare involved, having the wealth of community-based organizations involved from everything that they provide in a very robust way, to have this as a connection point, a first step, a way of tracking and knowing, really just helps in so many different ways. So thank you so much for sharing this information. Really just greatly appreciate it. Wonderful resource.
Thank you for the opportunity.
Yes, thank you very much.
Well, as our time winds down, I just really want to thank Christina, Diana. Thank you so much for your time. Thank you for sharing this resource. This is only day one of 5 days of events. There's a lot more to come. This is Texas Fall Prevention Awareness Week. And join us again at, well, tomorrow at 11 o'clock Central. And we will be joined by our colleagues at the state to talk a bit about Texercise, which was briefly mentioned. But thank you for all that you do. Please remember to visit Fall Prevention Awareness website at Falls Prevention Texas, all one word, fallspreventiontexas.org. Tell us more about what you're doing in the community. There's a survey there, there's resources there. Thank you so much. And with that, I will say have a wonderful rest of the day.